Audiobook, Memoirs of a Doctor by Dr. Andrew C.S. Koo, Part 3. Memories of Yesteryears. MU class of 72, 39 years after leaving medical school. Doctors from many nations came back to the same station. Memories came flooding back, unable to hold our emotions back. Singing, dancing, drinking, and dining into the dead of the night. Thank you for the nostalgic night of yesterdays gone by. Chapter 3, Undergraduate, University of Medical Undergraduate, University of Malaya. A dream, all a dream that ends in nothing and leaves the sleeper where he lay down. But I wish to know that you inspired it, quote unquote, A Tale of Two Cities, Charles Dickens. I spent the next 6 years of my life in Kuala Lumpur, the big capital city of Malaysia. 5 years as a medical student in the University of Malaya Medical Faculty, and 1 year as a houseman at the University Hospital, now known as UMMC. A dream realized. Established in 1962, the Faculty of Medicine, University of Malaya, or UM Medical School, is one of the 13 faculties, one of the 13 medical faculties. Sorry, I make a mistake. Let me do it again. Established in 1962, the Faculty of Medicine, University of Malaya is one of the 13 faculties of the University of Malaya. I was part of its 9 batch of students. This was the first and the top medical school in Malaya, with a very good reputation and ranking worldwide at the time. I started my career in medicine in July 1972 as an undergraduate student. This was a 5-year course followed by a 1-year housemanship. The childhood ambition of my life finally came true like a dream realized. As far as I could remember, I had always wanted to be a medical doctor. It was my sincere conviction becoming a medical doctor would give me a stable career, a better quality of life, and hopefully a stable source of income. I would then be able to help people who are sick, render assistance, relieve pain, relieve suffering, relieve anxiety, and so on. My opportunity to do all this had finally arrived, thanks be to God, who always had my interest at heart and always had me covered. Residential college years. For the first 2 years, I stayed in a residential college called the First College, as this was the nearest college to the Faculty of Medicine. It is just a matter of 15 minutes walk up a long and winding route. But traveling by motorbike would only take 5 minutes. After a week's orientation, we were ready to attend classes. On the first day of class, the Dean of Medicine, the late Emeritus Professor T.J. Dhanaraj, or Prof. TJD, as he was fondly called, addressed the class of 72-77 in the Grand Clinical Auditorium. I can still remember clearly the first words he spoke as though it was only yesterday. Medicine is a lifelong course. It is never 5 years in a medical school, quote unquote. He went on to say that what we learn would be obsolete the moment we graduate. He was spot on regarding this, and on retrospect, this turned out to be true. The food at the first college was horrible. The same food was being served every day, and I could predict exactly what food would be served on a given day. Fortunately, there was a Chinese food shop in the college where I could go and buy Chinese fried noodles whenever I wanted to. Professor Dhanaraj, the late Professor Dhanaraj said that a doctor should never stop learning because medical knowledge progresses rapidly. Doctors owe it to their patients to keep up to date with new knowledge and new skills so as to be able to practice safely. He said a doctor is like a pilot. If a pilot stops flying and did not clock in the required number of flying hours, he would be grounded. I also remember the late Professor TJD saying, if you want to make plenty of money, please go and do another course right now, quote unquote. By today's reckoning, this would not be true because medical practice has become so commercialized and profit-oriented. Today, doctors make a lot of money, especially if they are famous and are practicing in the right specialty. Medicine is both a calling and a passion. Without these two ingredients, it would be very difficult to pursue this career. The late Professor TJD was very knowledgeable, but was also very strict. He was a highly respected clinician and academician, not only in Malaysia, but also worldwide. We were very blessed to be taught by him. He was a very humble man. He set high standards for everyone to follow. Although he appeared to be very fierce in the classroom, he was actually very kind at heart, friendly, approachable, and helpful outside the classroom. Men taught by the best. The medical school curriculum was divided into two modules. The first being the preclinical module, where the basic sciences such as anatomy, physiology, biochemistry, parasitology, pathology, clinical pharmacology, public health, medical statistics, and so on were taught. This was for a duration of 2 years. The second was the clinical module, where students were allowed to clerk patients in the ward to learn the art and science of medical practice through the teachings of the lecturer and professor for 3 years. The preclinical years were quite boring as we had to study a lot of basic sciences and were not allowed to interact with patients in the hospital. It seemed almost irrelevant at the time, but this was not true. Without the basic prerequisite knowledge to back us up, interacting with patients would be futile and even dangerous. The preclinical years laid the strong basic foundation needed to understand and practice the art and Science of Medicine. After surviving the first 2 years, I moved on to the next 3 years of the clinical module. Our batch, consisting of 128 students, was among the elite of the Malaysian medical students at the time. We were truly blessed to have world-renowned and eminent clinicians like the late Professor TJD and others of his caliber to teach us the art, science, and skill of medicine. The late Professor TJD told us not to refer to any patients as case 1, case 2, and so forth. Behind every case is a person, a human being with a name and a soul. They were not to be called case number this and that, but to be addressed with dignity as individual by name. He constantly inculcated within us that knowledge, honesty, ethics, empathy, compassion, kindness, right attitude, and good bedside manners were the basic ingredients to success. I remember the clinical case conference taught by the late Prof. TJD in the clinical auditorium. One student would be selected to present a case to the class in front of him or her. There would be tension in the room as the poor student at center stage presented the case, terrified, expecting to be scolded and torn apart by the barrage of questions that followed. Even those who did not present the case would be equally terrified, especially those sitting on the front rows, expecting to be hauled up by the learned professor at any time. Even those who kept quiet could be hauled up for keeping quiet and not asking intelligent questions. Then there were the teaching bedside ward rounds with the late Professor TJD. Ever so often, he would make a spot diagnosis just by looking at the patient, even without taking a history or doing a physical examination. Students were amazed and spellbound. He would make spot diagnosis of patient with hyperthyroidism, hypothyroidism, end-stage renal failure, Parkinson's disease, rheumatoid arthritis, Paget's disease, Mongolism, choreoathetosis, and so forth. Professor TJD taught us the importance of observation even as the patient walks into the room. He taught us how to use all our 5 senses of observing, hearing, smelling, touching, and feeling to make a diagnosis. A good history and a good physical examination is also the key to making a correct diagnosis. I remember on one particular bedside teaching ward round where a student with chronic rheumatic heart disease was presented to the late Prof. T.J. Danaraj, palpating the character of the pulse, observing the JVP waveform, palpating for pitting edema, locating the position of the apex beat, palpating the precordium for trill, left parasternal heave, and palpating the liver size was sufficient for him to arrive at the diagnosis. He said that auscultation using the stethoscope was only required to confirm the diagnosis. The clinical acumen of the late Professor TJD was hard to match. Besides cardiology, he was also a neurologist par excellence. I was very amazed by his ability to elicit clinical science in neurology. Medicine is both an art and a science. They say you can train a monkey to be an engineer, but you cannot train a monkey to be a doctor. A monkey could be trained in the science of medicine, but not on the art of medicine, which involve emotions, empathy, compassion, kindness, and ethics. A medical student's life. My life as a medical student was not very dramatic or colorful by any stretch of the imagination. The preclinical years were very demanding. There were lectures to attend, practical work to do in the biochemistry lab, and practical work at the anatomy dissection room. The class was divided into small groups for anatomy classes, and each group was assigned one cadaver. Seeing a cadaver for the first time was not as frightening after all. Certainly not the way that was being portrayed to us in soap opera like Dr. Quincy. The cadaver had been preserved with some kind of embalming fluid to prevent decomposition. The smell of embalming fluid in the anatomy room was very strong and irritating to the eyes. I remember the professor of anatomy telling us to respect the cadavers because they were there for us to learn anatomy. After every dissection, the cadaver gets smaller and smaller until there would be nothing left. Each group became closely knitted together and built up a relationship over the year. Encountering Jesus via the VCF. We had a Christian fellowship group in my class consisting of 12 Christian classmates who were Christian before they entered medical school. Although I was a free thinker, they invited me to join them in their weekly lunch fellowship meetings and other activities. They shared the gospel with me, gave me a Christian book to take home, and even prayed for me. In my last spring cleaning, I came across this particular book with autographs and a lovely message. I became very emotional and could not hold back my tears, reminiscing the divine connection God had brought along my path. My Christian friends were very helpful, reliable, honest, respectful, and good role models. Through their influence, I came to know about the Christian faith. I also got to join the activities of the Varsity Christian Fellowship, (VCF), and made friends with some of my seniors who were Christians and members of VCF. Then in 1976, on the fourth year of my study, I became a Christian through the sharing of one VCF member who visited me in my room when I was right in the middle of a personal crisis. I was particularly fond of one classmate. He was a top scholar from Sarawak and had long beard. His nickname was Janggut, and Janggut means beard in Bahasa Malaysia, in our local Malay language. We were of the same wavelength and frequency, and we got along very well. He was a good role model, and we spent quality time and did many things together in our free time. Unfortunately, he had a girlfriend in the later years and did not spend much time with me after that. Reconnection. The student whom I taught tuition in Teluk Intan entered University of Malaya in 1974 as a dentistry undergraduate. The Faculty of Dentistry and Medicine was close by and we could meet easily. She also stayed in the first residential college. We got along very well and rekindled our friendship. She was also a Perak State Scholarship holder. concluding my clinical years. For the last 3 clinical years, I moved to the clinical student hostel, brackets CSH, which was within walking distance from the medical school and university hospital. This was much nearer than the first residential college. College life in the CSH was interesting. Students were very naughty. I also remember a particular incident when the college warden's car was splashed with red paint. He must have offended some student who took the law into his own hands as an act of retaliation. Students played volleyball, tennis, ping pong, sepak takraw, and sepak takraw in the evening. Some of my classmates played mahjong late into the night, even during examination, but still ended up with distinctions and placed among the top of the class. During lectures, they like to sit on the back row of the lecture hall wearing dark tinted glasses. Some of my classmates were very rich and drove new BMWs, while most of our professors were driving older Volvos or Peugeots. But by the grace of God, I was not a very good student, and hence I found the medical course rather challenging. There were plenty of things to read, remember, memorize, conceptualize, and understand. By the grace of God, I managed to pass all my examination and graduated with MBBS Malaya in 1977. In those days, due to a shortage of doctors, medical graduates were required to start housemanship immediately after passing the final examination. But to negotiate for a pay increase, our class refused to start housemanship immediately. This initiative forced the government to increase the housemanship salary from 650 ringgit to 825 ringgit. This was subsequently revised to 1,165 ringgit. After 12 months of housemanship in the University Hospital Kuala Lumpur, I was finally registered with the Malaysian Medical Council with a license to practice medicine. Some people call this a license to kill. But don't ever believe this. Life is sacred. The Hippocratic Oath says, above all, do no harm, quote unquote. After graduation, the MU class of 72 to 77 still keep in touch and met regularly to this day through Facebook, WhatsApp, and class reunions. Initially, we had class reunions every 5 years, but for the last 5 years, this had become a yearly affair. The last annual reunion was held successfully in Singapore, hosted by our Singapore classmates. A reunion was planned to be held in Ipoh in 2020, but unfortunately, this event had to be cancelled due to the COVID-19 pandemic. We hope that with the availability of vaccine, this pandemic will be over soon so that we can all reconnect once again.